In this lecture, we are going to discuss descriptive epidemiology. In the previous lecture, we have already mentioned the definition of epidemiology as the study of the occurrence of the disease by mean the frequency of the disease, determinant of the disease, and distribution of the disease in the community in order to propose preventive measures. And we mentioned that there are two types of epidemiology: the descriptive epidemiology and analytical epidemiology. In this lecture, we are going to discuss descriptive epidemiology, and by the end of this lecture, the student should be able to describe the differences of variation in the occurrence of the disease or health-related events regarding person, time, and the place. And also he can give an explanation for this variation. In addition, the student will understand the role of descriptive epidemiology in describing the population and helping in the exploration of variation in the occurrence of the disease to aid in the planning of health services. Descriptive epidemiology, it includes all the activities which related to the characterizing the distribution of disease within the population. What are the characters which categorize or distribute the disease among individuals in the population in a way that organizing and analyzing health data in order to understand the variation in disease frequency regarding the geographical area at different places at different times, and how disease or health varies among people based on the host or personal characteristics. So it is going to describe the variation in the occurrence of the disease regarding person characteristics, a place, and a different time of the year. So this makes it possible to identify the trends in health and disease, and also provides means of planning resources for the population in order to plan relevant healthcare services. In addition, descriptive epidemiology is important for generating hypotheses, possible explanations about the determinants of health and disease. So, in descriptive epidemiology or by descriptive study, we are going to generate an hypothesis about the distribution of the disease according to these three factors. And also, by generating the hypothesis in descriptive epidemiology, it provides the starting point for analytical epidemiology. So descriptive epidemiology, it is regarded as the starting point for planning of analytical epidemiology in order to establish the association between the different factors and occurrence of the disease. So there are specific tasks of descriptive epidemiology which include the following. First, monitoring and reporting on the health status and health-related behavior in the population. So it is not only responsible of observation of the disease in the community, but also the health-related events or behavior of the population that it is distributed or affect the occurrence of disease. Also, identifying emerging health problems. So, by observing the data, health-related data, so we can identify the occurrence or emerging of different type of health problems. Establishing public health priorities for population. After we take different information to describe the occurrence of the disease regarding its distribution according to the individuals affected at what places at what time. So according to this information, we are going to put health priorities. What are the health priorities in this community? What are the common health problems in this community, and what are the need for the population and the regarding the healthcare services? Also evaluating the effectiveness of intervention program. For example, the evaluation of different health services or health programs by calculating different coverage rates. For example, for vaccination, we see how many individuals have been vaccinated, especially for children, against the infectious diseases by calculating the coverage rate. So it is regarded as one of the evaluating material for the health services. Exploring potential association between risk factor and health outcome in order to generate hypotheses about determinant of the disease. By descriptive study, we are going to propose a potential association by applying a hypothesis about the association between risk factor and outcome or the disease, and then we are going to approve this association by applying the analytical study. So descriptive study, we are going to describe the occurrence of disease regarding personal characteristics, place distribution of the disease, and the time occurrence of the disease. So three groups of variables are commonly used in descriptive epidemiology, as we mentioned: the individual characteristics such as age, sex, marital education, occupation, habits, genetic factor, and ethnic group. There are different diseases occur regarding age or sex or the marital status, socioeconomic status or occupation or genetic factors, and we are going to discuss this later. Also, the characteristic of a place, the distribution of the disease regarding the place, whether it is an international occurrence of the disease or global occurrence of the disease, or national, where it is limited to one state or one country, or continental or local in certain area in certain country, or urban rural distribution. So this is we are going to describe the distribution of the disease according the place. Also, we are going to describe the characteristic of the occurrence of the disease regarding time, whether it is a secular trend over many years and decades, or seasonal trend or seasonal variation in the same year but at different season or different semesters, and also a recurrent pattern or cyclical pattern every year. So the distribution of the disease regarding age. It has been found that there is variation of disease distribution regarding age, may be explained by different explanations. It is also it have seen that the distribution of the disease regarding age diseases among children, they are different than among older age group. So the variation in the occurrence of the disease regarding age, it may be related to the first, accuracy of the diagnosis. Sometimes the diseases are difficult to be ascertained or ascertained at extreme age of a group, such as in the elderly population or in the children, and this will lead to sometimes to underestimation of certain causes of the death or the diseases. Among elderly people or children. Especially elderly people, they have multiple diseases, or what we call it comorbidity. They have different health problem at the same time. So the cause of death, it may be incorrect by having this different health problems. Also in children, sometimes it is difficult to diagnose the health problem because we rely rely on the information which is given to from the mother rather than from the patient himself. So it is unreliable, or sometimes it cause underestimation of the or overdiagnosis or underdiagnosis of certain health problems. Also, there is variation in the intensity and the duration of exposure to the factors. This can be explained by that the period of exposure to the risk factor. The older age group, they have been exposed for longer period of time, so there is accumulation of the risk factor, so the appearance of the disease will appear later in life, because some diseases need high exposure or long period exposure for certain risk factor for the development of the disease. So there are some diseases which need higher dose, higher exposure dose, so it be diagnosed mostly in elder group rather than in children. Variation in immunity and susceptibility. It has been stated that people are not constant in their immunological response and immunological status, and are not necessarily similar to each other in that respect. So the immunological status is variable between individuals. Some individuals have good immunity because immunity depends on many factors. For example, individual with malnutrition, for example, they have low immunity, so they are more liable to have infections or severe infection or super added infection. Individual with AIDS, for example, they are more liable to have a tuberculosis, super added infection with the tuberculosis, or pneumocystis pneumonia, because of they have low immunity, and this is called dual infection. Or individual on immunocompromised drug or steroid, they have low immunity, and this will lead to exposure to different type of infection, in addition to the autoimmune diseases and different type of diseases because of inadequate immunity. The bimodality, in some instances, the distribution of it is defined as the distribution of disease frequency with age, which may have two peaks during the age graph. So as you see in the top of the right side of the right slide, on the right side of the slide in the top, we can see that there are two peaks. This peak represent the peak, one among children and the other among the elderly. So there are two peaks of the occurrence of the disease regarding age, and this can be explained, such as in Hodgkin disease and leukemia, testicular cancer, and tuberculosis. There have two peaks during the as regarded in the curve of the age. This is explained that bimodality is maybe suggest the heterogeneity of the data, different data for different disease, or the two diseases have different entities rather than with one disease. For example, in tuberculosis, the first peak in children, it is the primary tuberculosis. The source of infection is exogenous infection, while the peak later in life, it is a secondary, which is endogenous from the side of the body, and this is endogenous tuberculosis. Aging or biological clock. Sometimes people become very old or aging and loss of ability to carry out even simple tasks, yet they have no apparent disease. So the aging process, it is a physiological process or biological process, and this is by aging of the cells. So some individuals, they have no disease, but because of biological changes or because of the biological clock, they are unable to perform or to carry out the everyday living activities. So they probably follow a pre-coded biological clock which determines the lifespan. Distribution of disease with age. Also, it has been noticed that there is variation in the occurrence of illness between the two sexes. So, being a male or being a female, there are different rates of occurrence of disease. It has been stated by epidemiological studies that males have higher rates of illness and death than females, and this is a wide range for different type of diseases. This for some diseases, sex related differences is because of genetic factors. There are certain diseases which are genetically determined, and it is for example, occur in female rather than male according to the genetic factor. For example, G6PD deficiency, it is one of the enzyme. If the deficiency of this enzyme, the female carry this gene on the X chromosome, and she transmit this to the male X chromosome, and he will have the disease because he got one X chromosome. So, or the hemophilia, this is another example. So, a genetic factor determine certain diseases, the occurrence of certain disease. Hormonal factor such as the estrogen. Estrogen in the female, it is regarded as a protective hormone because it cause an increase the level of high density lipoprotein and decrease the low density lipoprotein. So it is a protective against coronary heart disease. After menopause, the risk may be equal after the reduction in the estrogen in the female and the menopausal women. Anatomical factor such as the diseases of women during the reproductive age group, it is because of the pregnancy, delivery, and lactation, or because of the contraceptive or family planning methods, or they are for example, breast cancer, it is more likely to occur in female than male, and the testicular or prostatic cancer is the disease of men. Other inherent difference, there are different causes of this variation because of inherited factor. These inherent difference affect their susceptibility or physiological response. For example, premenopausal women, as we have another example, she have a lower risk of heart disease than men of the same age. This difference is attributed to higher estrogen level in women. And as we mentioned, after menopause, they have equal risk. On the other hand, the sex-related differences in the occurrence of many diseases reflect differences on opportunity or level of exposure. For example, hand-wrist disorder, or what is called the carpal tunnel syndrome, which occur more commonly in female because of the homework, and this is more likely to occur at the wrist. This may be attributed to their higher level of exposure to occupational activities at the hand-wrist motion, such as in typing or keyboard or at home work. Distribution of disease with marital status. In many studies, it was reported that death rates and suicidal rates are higher among non-married people, single, widowed, or divorced, than they are in married people. This is true for both males and females. Such variation might be difficult to explain, but there are two explanations are possible. So it has been stated that the disease rate or death rate are higher among single people or non-married people, widow or divorced, and this can be explained by the following. First, marriage stabilizes life and reduces the risk of exposure to hazardous behavior. As married people, they will be responsible not only for themselves, but also they are responsible for a family, so they should be very careful and avoid certain risky behavior. And unmarried or single are actually not healthy to start start with, and they prefer not to marry. So because they don't marry, they didn't marry because of because they have disease before they marry, so they prefer to be unmarried rather than have a marriage. So the higher risk of death and suicide among them is perhaps related to their poor health or due to unhealthy lifestyle or unstable life. Socioeconomic status. The classification of people according to socioeconomic condition, whether they have high or medium or low socioeconomic status, it is variable among different societies, and it is difficult to categorize people because there are many interrelated factors in the classification of socioeconomic status. Some people rely on occupation or family income or education achievement, living condition, and social standing, and some take all these together to have or classify people into different socio-economic status. But the frequency of many adverse health conditions increases with the decreasing socio-economic status. For example, tuberculosis is more common among persons in lower socio-economic status because of low nutrition or bad nutrition, overcrowding, lack of ventilation. So all these factors may be attributed to the occurrence or predisposed to the occurrence of tuberculosis. And also it has been stated that different type of infection, they are more likely to occur among people living in poor homes or low socio-economic conditions. Infant mortality and time lost from work due to disability are both associated with lower income. Different type of diseases are more likely to occur among individuals with the socio-economic status. This may be related to poor occupation or no occupation or unemployment, poor nutrition, lack of education, and poor quality of house, and inappropriate water supply, lack of ventilation, overcrowding. All these factors are associated with the occurrence of disease, in addition of the lack of utilization of healthcare services, all attributed to their variation in the occurrence of type of the disease and the occurrence of the disease, the treatment used, the utilization of healthcare services. All these are attributed difference in the occurrence of disease. This pattern may reflect more harmful exposure, lower resistance, and less access to the healthcare services, and may reflect the interdependent relationship. Does low socioeconomic status contribute to disability, or does disability contribute to lower socioeconomic status? Sometimes it is physical circle. Some adverse health conditions are more frequent among persons of higher socioeconomic status. These conditions include breast cancer, gout, obesity, and tennis elbow. So there are different diseases among different socioeconomic conditions. Again, differences in exposure accounts for at least some of these differences in the frequency of the conditions. Association of disease distribution with the place. There are different places have different diseases. The following criteria are essential to demonstrate an association of disease distribution with the place. In order to say that there is association between place and occurrence of the disease, there are 4 criteria. It should be available to have this hypothesis. First, high frequency rates of disease are observed in all ethnic groups living in that place. For example, we always give example of malaria in Africa. Malaria is one of the endemic disease in Africa, and it affect all age groups, and so it is associated with the place. So it is one of the endemic areas. Healthy people entering the place becoming affected by the disease at a rate of similar to that in people who are already living in this place. So any individual who, for example, go to Africa, most likely to get the disease if he didn't receive the prophylaxis. So that's why many people who are traveling to an endemic area for certain disease, for example, in Africa, they are going to have a prophylaxis against malaria to prevent contracting this infection. Another criteria is that people who leave the place and move to other places do not experience high frequency rate, and that's why what we see, the African people who migrate to different countries, they are less likely to have or decrease the risk of having malaria. Species other than man may show a similar pattern of the disease. So also, for example, another example, we can give an example of leishmania or leishmaniasis. It can affect the human also in endemic places, and it can affect man. The characteristic resulting or relating to place, it is either international occurrence of the disease. There are certain diseases, they have international distribution, or there are international difference in the occurrence of the disease. For example, there are substantial difference in the incidence of stomach cancer in Japan and than in USA. And there also substantial difference in the genetic. This difference may be due to genetic factor, climate, culture, diet, and access to health care services. So individual, they are and less likely to have, for example, stomach cancer. But when in Japan, but when they go to USA, they are more likely to have become more liable to have the stomach cancer because of change in the culture and the environment and the diet and in the behavior, or variation within the country itself. Either it is local, for example, gastroenteritis is higher among children in area who lack the proper water supply. So there are local variation. For example, there are certain infections which are localized to certain area because it is associated with certain risk factor, such as the occurrence of gastroenteritis if the individual have improper water supply or an improper sewage disposal. Urban-rural variation. There are differences in the distribution of the disease in urban area than rural area. Rural area, usually they are agricultural culture or agricultural area, while the urban they are industrial. So there is variation. For example, in the urban they have, for example, different industries. So they may have pollution, for example, pollution, or they have population density, high population density in urban area. Level of sanitation, it is more better in the urban area than the rural area. Deficiencies of medical care, there is variation in the level of medical care in the whether in the urban or in the rural, also and difference in the educational level or environmental factors. All these factors may attribute to the differences in the occurrence of disease between urban area and rural area. So these may result in variation in, for example, chronic bronchitis, cardiovascular diseases, accident, and more frequent in urban area than in rural area, while skin and zoonotic diseases and soil transmitted ailments are more likely to occur in rural than urban. So there is variable diseases or different diseases in different places according whether they are urban or rural. For example, the occurrence of goiter. Goiter is higher in mountainous area and lower in other places because of the it has been stated that individuals who are living in the mountainous area, because of the lack of consumption of seafood, which so they will have deficiency of iodide, which is essential for the formation of the thyroxine. So individual with the low this will result in the development of hypothyroidism and result in goiter. Also, the incidence of schistosoma, for example, is a higher have higher incidence in villages and where people use water for everyday life and for swimming and for other needs. So, because the schistosoma, it is, as we mentioned, it is transmitted. It is one of the parasite which need the snails as a vector, which is breeding in the water, and it need time for the development for the larvae, for the cercaria, in order to be infected to human. And when human come in water, they come in swimming or having their work in the water, so the cercaria penetrate the skin and it will cause the infection. Variation of the occurrence of disease regarding time. It has different types. It had different types, such as the secular changes or long-term occurrence of disease, which take long time for the occurrence or to recur for centuries, or cyclic trends, regular frequency of the disease, and seasonal variation, where the occurrence of the disease vary according to the season, and point epidemics. The secular changes, it refers to changes in the occurrence of disease over a long period of time. For example, coronary heart diseases or diabetes showing constant upward trend and a decline in tuberculosis in the developing countries, while TB and polio becoming down for the last 50 years. So there is change in the trend of the occurrence of the disease in the developed countries because of the improvement of the lifestyle and because of the improvement of life and because of different lifestyle, and there is an increase in the increase of smoking or alcohol or lack of physical activity. This will lead to an increase in the occurrence of coronary heart disease or diabetes, while in the previous now in developed countries, but there is a reduction or decline in infectious disease such as tuberculosis or polio for the last 50 years. The changes occur over years or decades. Example of changes in cancer and cardiovascular disease. Cancer is increasing now rather than in the previous. And such secular changes which shows a clear rise in the disease frequency with time, years or even decades, as has been shown with the rise in mortality rate due to lung cancer in some European countries during the 20th century. And this rise could be explained by the following. So the rise in the frequency of the disease with time, it have explanations which we are going to would have two explanations, and this could be a real increase. This increase may be real increase in the incidence of the disease, or it may be an artificial increase. The real increase in the incidence, this could be due to massive exposure to a disease agent, maybe because of introduction of certain agent, whether it is infectious or chemical or poisonous or environmental factors, or maybe change in the lifestyle, an increase in the smoking, for example, or lack of physical activity, and this will lead to an increase in the obesity, for example. Failure of adaptation to social changes. Some people, they have difficulty in failure to adapt to a new life, especially after migration, and may develop stress, for example. The other explanation is the artificial rise in the disease. There is no real increase in the disease, but it is an artificial, which could be due to improved diagnosis of disease, which lead to the identification of cases which were previously missed. Because of the increase in the awareness of people to different health problems, so most of people they try to attend the health services for investigation or for having certain investigation to not to be missed. And changes in the classification of disease, there are changes in the classification of disease, and also improve recording of this of cases. One of the problem in the healthcare services is the registration or recording of cases. So some of the hospital which use electronic electronic registration or files, so it become or computerized of some of the information, so it have better records, and this may lead to an increase in the awareness of the disease. Also, aging of the population or change in the population at risk. Cyclical trend, as you can see from the diagram, there is a regular periodic occurrence of the disease at regular interval. For example, every year, every 2 years, every 5 years, but it is recurrent in a regular pattern. So the cyclical trend, recurrent alteration in occurrence, interval, or frequency of the disease. Some disease occur in cycles spread over short period of time, such as days, weeks, months, or years. For example, influenza pandemic are to occur at interval of 7 to 10 years due to antigenic variations. Or non-infectious condition may also occur in this trend, such as automobile accidents, for example, which are more frequent at the weekend. So at the weekend, they have a high number of, for example, the car accident, for example. Cyclical trends also it can be due to migration, school years, or military development. Some of the occurrence of disease may be occur in the school at the recurrence of the school or the beginning of the schools, or those who attend the military health services. The seasonal variation or seasonal changes, that means the occurrence of the disease vary with the season, whether in summer or spring or in autumn or in winter. So it is a seasonal variation. There are large number of diseases which are related to the season, such as, for example, allergy. Allergy, it is more likely to occur either in autumn or in spring at the starting of the pollen, which cause as regarded as allergen, and this so a change of the disease frequency within the year reflects a change in the population immunity or susceptibility, or due to change in the environmental situation in favor of the disease agent development or multiplication, such as in malaria, or and it is a transmission due to new host. So seasonal fluctuations may be due to environmental factors. For example, malaria, it is more likely to occur to occur after winter, in spring and summer, because after winter there are collection of waters where the Anopheles mosquito will breed, and it will increase the transmission of the infection. So there are so the environmental factor enhance the transmission of certain diseases. Or occupational activities, such as certain occupation are associated in certain exposure, which result in, for example, the heat stroke. The heat stroke is more likely to occur in summer rather than in winter. Or recreational activities. Some diseases, for example, travel diarrhea, it is more likely to occur in summer rather than in winter because it is related to travel. So, seasonal variation can be used to suggest possible etiology, such as malaria, influenza, or meningococcal meningitis, or asthma. Non infectious disease and condition may also exhibit seasonal variation, such as high fever due to the allergy, or the sunstroke, or asthma, or different allergic process. Regarding the this difference in the occurrence of the disease, as we have already discussed this, but we can have just a quick revision over this, which is endemic. We mentioned that it is the habitual existence or persistence of the disease in certain geographical area, and this is due to the persistent existence of the infective agent or the risk factor. The epidemic, which is the an increase in the occurrence of the disease, which is more than expected, more than its normal expectancy. And there are two types of epidemics, which is either common source or point source epidemic or propagated epidemics. Hopefully, we are going to discuss this in another lecture. Pandemic, as we mentioned, it is an international or worldwide epidemic of transmission of infections, such as in the COVID-19 by now. Time clustering. It is the occurrence of the disease in certain places and that occur close together at certain time or in term of time and place. For example, cluster analysis used for the rare special diseases event. For example, time clustering for the thalidomide. Thalidomide, it is one of the drugs which is used for the treatment of sleeping pill and is in the beginning of 50s, and it is used as a drug as antiemetic in morning sickness and pregnant women. So it has been found that many pregnant women deliver to babies who have an abnormality, which they who have limb deformities such as phocomelia as a consequences of thalidomide use. As you see in these photos, there are lack of hands and or legs among individuals or born to mother who have already consumed thalidomide during that period of time. So only at that period of time. So this is called time clustering. And thank you.